This is Monde Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Monde Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Monde Health, you can feel the difference. Once again, welcome to this edition of Monde Health Talk.
Good morning. Welcome to the program. I'm Dave Wilson. She's Sarah Giossi. Good morning, Sarah. You got to hit the red button. Good morning, Sarah. And this morning, we're going to have a lot of heart in the show today. See what I did there?
Wow.
See what I did there? Joining us in studio this morning, and here's a name I'm not going to mess up today. So proud of myself. Dr. Richard Smith. Seriously, Dr. Richard Smith, cardiologist with Monde Health Heart and Vascular Center. Good morning, doctor. How you doing, bud?
Good morning. Doing well.
Catch any ball games over the weekend?
Unfortunately, yes.
We should probably just rather not talk about that.
Unfortunately,
We'll just
yes.
move on. We'll just move on from those. Dr. Smith, we're going to obviously be talking about heart disease as we move through this program, but I think is this your first time in?
Yes.
All right. We've got a newbie, Sarah.
All right.
I kid. Tell us a little bit about yourself, where you came from, and how you ended up in Morgantown.
I grew up in Clarksburg. Actually, I went to Liberty High School and went to West Virginia Wesleyan College, and then WVU for med school, residency, and fellowship in cardiology.
What interested you in cardiology?
I kind of grew up with heart disease in my family. My grandfather had heart attacks when I was really young. Remember going into the hospital, seeing him, when I was like 4 or 5 years old, and then he passed away from coronary disease, when I was about 10 or 11. So it kind of was always in my head that way. And then once I got into medical school and residency, I really kind of went towards that because it was just the most interesting thing that I had found at that point.
So how do you end up at Monde Health now practicing?
When I finished residency, there was openings there. I wanted to stay in the area, and so I ended up there. It's been a great place. I love it. Love the area. Love the hospital. It's great people.
I think we see that a lot when we do these interviews, that we have a lot of folks that are more local that work at Monde Health, and I think that talks a little bit. We end up coming back to this every single week, that Monde Health is a place to go if you want to really feel that connection, if you want to get some one-on-one care, and you want to have people that really care about our community. And I think being more localized is a big piece of that. Do you agree?
Yeah, I would agree. We have a lot of docs, nurses, everyone that are really local people that come and have stayed for years and years and years. We have, multiple staff members that have been at the hospital for 15, 20, 25, 30 years, and there's a reason for that. So
Making a positive impact on your home I don't know. I think it has such a different, meaningful purpose sometimes than going elsewhere.
Dr. Richard Smith, cardiologist at Monde Health Heart and Vascular Center, joining us. So when we say heart disease, first thing that pops into most people's heads, probably heart attack, but it's a much broader area than just the heart attack, right?
Correct. That's sort of the more, and the most acute, issue or injury. People can have, again, what's called stable coronary disease or stable angina, which means you do a certain amount of activity, you get chest discomfort or shortness of breath, you rest, it goes away. That's typically, a lot of times how people start even noticing symptoms or things that way. Then you can have sort of the next step, sort of right before, heart attack, which was what's called unstable angina, which is when you start noticing increasing symptoms with less activity, lasting longer, more intensity, not going away with rest as quickly, or beginning to have even symptoms at rest, as far as, again, chest discomfort, shortness of breath, or having them more often, more frequent in those episodes. And then again, the sort of the ultimate or last line of what most people consider heart disease or coronary disease is, again, the acute heart attacks, or what's called a myocardial infarction, where you actually have heart muscle injury because of blood flow issues.
Is there a particular group of people heart disease seems to affect the most?
It's actually, it affects everybody. It's the leading cause of death in the world, essentially, and it's definitely in the United States. Not the world, but in the United States. As far as, and it's both men and women, and at any age. The more I practice, I'm pretty young myself, and I see a lot of people even younger than me in their 30s, early 30s even now, beginning to have coming in with coronary disease, heart attacks, and other issues that way. So it's not just sort of my father's disease or my grandfather's disease anymore. It's affecting a lot more young people every day.
Tell you what, let's squeeze in a break. We'll get into symptoms to look out for, how it's treated, and later Sarah will discuss the importance of exercise, diet, and not smoking, because I can see where that's going to end up before we get out of here today. We're talking to Dr. Richard Smith, cardiologist with Monde Health Heart and Vascular Center. It's Monde Health Talk on WAJR.
This is Monde Health Talk, providing a window into the Monde Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Dr. Richard Smith, cardiologist with Monde Health Heart and Vascular Center, joining us in studio. And one thing you and I have learned on this program, Sarah, and we're going to get to this in a moment, it's easier to prevent it than come back and treat it after the fact. I will let you get on that soapbox momentarily.
Yeah.
Until that point.
Not that all the physicians aren't amazing and you don't want to meet them in person, but if you can avoid it, that's ideal.
I'd rather not have to crack my chest open,
Right.
That's all. Dr. Smith, when we're talking heart disease, what are some symptoms to be aware of that something ain't right here, to put it bluntly?
I mean, there's a lot of different symptoms that people can have with coronary disease. Again, most people think of the classic, chest discomfort, elephant on their chest, mid-chest, goes to their arm, go to their jaw, go to their neck, associated with shortness of breath or sweating, nausea. That's, again, those are more, a lot of times, the findings, people have with acute, muscle injury. But you can start having some of those symptoms, that you notice just vaguely. Again, most of the time when people are active or, exerting themselves is when people typically will notice things that way, because that's your heart, muscle cells not getting good enough blood flow and good enough oxygen. So the discomfort is because you have nerve, fibers going to your heart that's getting injured, and they're saying, hey, we're not getting enough blood flow. Slow down, stop, so we can catch up. Sometimes people don't have a lot of the typical symptoms. Diabetics, especially, a lot of times don't have typical symptoms. Sometimes, again, it's more just shortness of breath with activity. Sometimes it's just being more generally fatigued than you were when you're doing certain things. Again, also, women sometimes don't have the sort of the typical symptoms. Sometimes, shortness of breath with exertion. Shoulder pain, back pain with activity, things that way can also be other signs.
Friend of mine who's a fellow sportscaster over the summer swims 3-4 days a week. Diets, it is what it is. If you're a sportscaster, you know what I'm talking about. But he had gone to the pool, went swimming that day, was eating dinner that night, and thought he had a catch in his shoulder, kind of in that back area, and didn't think anything of it. And later that evening, he said he just felt weird and went, you know what, maybe I should go get this checked out. Took a couple of EKGs later to find out he'd, in fact, had a heart attack. They go in, do the cath, find a 95% blockage in the widowmaker. And he thought he had a catch in his shoulder.
Yeah.
As simple as that.
Yeah, and that's the thing. I mean, again, not everyone has, the classic, symptoms. And so that's why, we try to make people aware that, it's not only just that. If you have something that's persisting or especially coming on consistently and not going away, especially when you haven't done anything, that should, would make you think that this is just a muscle pull or this is something else, you definitely want to get it checked out, and sooner than later, especially if it's ongoing.
Because guys, Sarah, we're hard-headed, and I can only speak for the male species, but we'll make up, I think, any excuse under the sun why it's not the old ticker.
Oh, yeah, for sure.
Well, and I'm sitting here thinking about it. You're talking about shortness of breath and fatigue, and I have a 3-month-old.
Right.
And so I feel like that's me all the time. So are there other ways, especially as we're talking about this, and because sometimes people will not have traditional symptoms, should we be going and getting screening? Should we just be doing regular checkups with our PCP? What do we do?
Well, I mean, I think that's a good way to start is, again, seeing your primary care physicians and, again, having them make sure that your risk factors and things are controlled. Make sure your blood pressure is well controlled, your cholesterol is well controlled. If you're diabetic, make sure your sugars are well controlled. If you smoke, obviously quit smoking. Diet, exercise, all of those things. If you start noticing more things that you're not sure of, again, like you said, with the shortness of breath, fatigue, again, you want to see someone, and then, based on that interview with them, they may determine you need other testing and screening, things such as stress testing or even coronary, it's called a coronary calcium score, looks at calcium deposition in the coronary arteries, is again a very good screening tool, especially in low to intermediate risk patients, to get an idea of if you have more of a propensity to have coronary disease at that point.
We're talking to Dr. Richard Smith, cardiologist with the Monde Health Heart and Vascular Center. We'll talk preventative measures next. Sarah's got her soapbox out, and she's ready to get on it. We'll do that next. It's Monde Health Talk on WAJR.
Now back to Monde Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our Monde Health guests, call now, 304-296-0041.
Dr. Richard Smith, cardiologist with the Monde Health Heart and Vascular Center, joining us here on Monde Health Talk. Dave Wilson, Sarah Giosi. And Sarah, if I've learned one thing on this show, well, I've learned a couple things actually, but if I've learned one thing, diet, exercise, and quit smoking, boy, that'll do a lot to help you overall, especially when we're talking heart and vascular.
Yeah, and I was saying this on the break. It's a simple solution. That doesn't mean it's easy. Quitting smoking, it's a simple solution. Just quit smoking. But that doesn't mean it's easy to quit smoking. And we can be empathetic toward that. But it's true. It plays such a big part. Now, besides diet and exercise and making sure that you're not smoking, are there other preventative measures folks can take?
Yeah, I mean, as far as, again, you just want to make sure your risk factors are well controlled. Again, the main big risk factors for heart disease and coronary disease are, again, high blood pressure, hypertension, high cholesterol, diabetes, obesity, inactivity. And so, again, if you have high blood pressure, if you don't know what your blood pressure runs consistently, you sure definitely want to get that evaluated, checked out. Again, if your cholesterol is high, again, diet, exercise, medications if needed based on your risk scores at that point, based on age and other risk factors. And again, diabetes is a big one, especially here in West Virginia. And that's a lot of the problem is people don't really control these things well. It's okay. Or how, when you ask people, how are your sugars doing? Oh, well, they're doing okay. Well, okay to them may not be actually okay for what it really needs to be. And again, it's education. A lot of times when you see patients and see people, in the clinics, not only with us, but also, again, with their primary care physicians and providers, to really educate people what's good, what they need to be, where they need to be, how to go about doing that, and then, making sure that they follow up with doing that and keep close eye on those things.
We're speaking with Dr. Smith, cardiologist with the Monde Health Heart and Vascular Center. I just want to, you mentioned in West Virginia, and earlier you were mentioning some statistics that were nationwide. Talk to me, though, for West Virginians, for those that are listening to the show that live right here, why is this so important?
Again, this is the leading cause of death in West Virginia, both men and women. And, we're seeing more and more people younger and younger having significant coronary disease or even dying from coronary disease. And I mean, I looked up some stats earlier, and it starts with the young people, even in their early childhood years and teenage years. 27% of young adults still smoke.
Wow.
30% of young adults don't have any consistent exercise whatsoever. And over 38% of people are classified as obese in West Virginia. In young people, again, it was about 25% of kids 10 to 17 years old are classified as obese. At this
One
point
out of
in
4.
Yes.
I mean,
Which is
mind-blowing.
which is a large increase from the last 10 years. It was still not great then, but it was about 15 to 16% at that point.
So incredibly important right here for us. We need to be focusing on this. Now, again, if you're having any concerns, is this something where you need to get a referral from your PCP, or can we just make an appointment with you?
You can get a referral. You can also just contact the clinic itself, and you can get the information at mondehealth.com/heart. Is the website. You can make self-referrals, but you can also see your primary care provider and get referred as well.
Okay. All right. I don't know. I'm kind of blown away thinking about some of those numbers you were just sharing. It just
and we see it every day, and it's becoming more prevalent and more of a problem day by day.
And again, we've got to work. No offense, we've got to work to not see you. But
right.
If you're having these problems, you're lovely. It would be lovely to come and see you. And again, if you want to get some things checked out, mondehealth.com/heart. And of course, the Facebook page. Yes, Monde Health on Facebook. You can always check out and get more information there. And hopefully this show and these types of conversations with people like you, Dr. Smith, are going to help raise some of this awareness. And at the very least, as we were talking about, you don't always know what those symptoms are. So just having that conversation can be really, really helpful. And we talked about how obesity can play a big role, but also sometimes it may be someone that you're thinking, well, they seem young and they aren't overweight. And
Right.
sometimes those people can have these issues too. I mean,
For sure.
it doesn't have a direct formula. So it's good to talk about that.
I got one more question.
Yeah.
Do people ever see you coming at a tailgate and put down their plate of buffalo wings and deep fry and go, oh,
Yeah.
God, comes the heart guy?
No, not so much.
Hey, thanks for joining us this morning. We do appreciate it. Again, mondehealth.com/heart. For more information, of course, go to the Facebook page. Dr. Richard Smith, cardiologist with Monde Health and Heart and Vascular Center. Enjoyed our conversation, but I really hope I don't have to come see you anytime soon.
Thank you.
Yeah.
All right, coming up next, we got the top of the hour. We've got Fox News, local news, and then it is time for the talk of the town. That is all coming your way. You've been listening to Monde Health Talk on the voice of Morgantown, WAJR.